Hi, my name is Karina Akido. I'm the managing editor of Canadian Auto Dealer, and I'm here with Karen O'Connell with CADA. Karen, this year CADA 360 celebrates its 70th anniversary, and the program has come a really long way. So what I'm looking to know is, what are some of the biggest changes that have occurred over the years?
Thank you, Karina. It's a pleasure to be here today. I think the biggest changes we've seen have really come in the last 10 years. It's really been developments in what's going on in pharmaceutical products. You know, in 1950, it wasn't fathomable that there could be a drug that cost more than $100,000, but today they're fairly commonplace. So managing the risk under the program has been a very important goal to make sure that the program is there when these new treatments do become available, that there are dollars there to fund them. So the managing of the risk of the program looks very different today than it would have in 1950. And I think that's a significant accomplishment and being able to do it in a sustainable way.
Thanks, Karen. And one of the things I find interesting about CADA 360, so I'm hoping you can elaborate on this, is the idea that it was created by dealers for dealers. So maybe you can add a little bit to that and expand on it.
Sure, it was set up as a not-for-profit trust, and it's run by a dealer committee, and they're very conscientious of making sure that it's dealers for dealers, and that the money that comes in premium contributions is there for the benefit of all plan members. And they look for opportunities to either improve benefits or to keep costs down. And managing those costs to keep those premium rates affordable is very important to the committee. And it allowed us to be in a solid financial position this year when the pandemic hit, that the committee was able to very quickly make a decision about what would be of most immediate need to dealers, and that's where they came up with the premium credit for the months of April and May. And because of the prudent management of the plan, it allowed them to make that decision very quickly, and they knew they were providing immediate relief to dealers, and which would then buy them some time to figure out what was going on. And to also add to that, they also kept the rates in place until next June of till 2021. So that rate freeze also helps with budgeting and planning. So they're not facing any unknowns in terms of premium rates. So that's the benefit of being in a not-for-profit, and that whole philosophy of dealers for dealers. They're always looking out for their fellow dealers.
Perfect. And let's shift over here to new developments. So I understand that CADA 360 has offered or introduced new developments this year, especially amid the pandemic. Would it be possible to kind of share what some of those developments were?
Sure. One of the things that we did actually in late 2019 was to introduce an employee assistance program. And that was done before the pandemic, but it was certainly very timely because we know that many people are struggling with anxiety and the added stress of the pandemic and having to homeschool children. So having the access to an employee assistance program has been an important resource. And we had just rolled it out not too long before the pandemic hit. And then we've also introduced telemedicine through our plan administrator, CADA Life. And that's an offer that dealers can add to the program. But again, something that can help when you can't get access to your family doctor in a timely fashion, or if you need help in off hours. So those are two really new developments where we're keeping up with the advances that are being made in delivery of benefits.
So my final question for you is, 70 years is a big milestone. What does it mean for CADA 360 to be celebrating that milestone?
Well, 70 years for any benefits program is a significant accomplishment. Many associations try to set up plans, and they often can't get the traction that CADA has been able to get. And the dealers are very loyal to the CADA program, and that gives us strength in numbers. So with 70,000 plan members, that gives us a lot of leverage in the marketplace and allows us to spread the costs over the greatest number. And, hopefully we'll be here well into the future.
Perfect. Well, thank you so much, Karen, for taking the time to do this interview. And as always, I wish you and your family good health and safety during this period.
Thanks, Karina. Same to you.